of the House Education Committee. The bill is part of my legislative package, and it creates a framework to make sure that Title IX reporting and accountability happens. It happens properly, it happens timely, and with severe repercussions when it doesn't happen, absent a compelling reason. Yesterday, Senate Bill 230 by Senator Beth Mizell, but also Senate Bill 232 by Senator Barrow, were passed out of Senate Education Committee. I'm supportive of all three of these efforts, which working in concert to address this problem on our college campuses in Louisiana. And you've heard me say before that when women succeed, Louisiana succeeds. And it's also true, as is being made clear now, that when women lead, Louisiana succeeds. The women legislators here have set an example of how to confront an issue, listen to powerful but difficult testimony from those most affected, and find ways to address weaknesses in the system through the legislation that they consider and pass. And so I did want to take just a moment and let the Senate Select Committee on Women and Children know that I and the state of Louisiana appreciates their work on this issue. And I know that they're going to continue to call people to the table to answer questions and to be accountable. And it's essential, and I've said this many times, that our students feel safe and be safe on our campuses, and that the parents of those students know that they will be safe. There is not much opportunity to be gained through higher education absent basic safety and well-being. So it's incredibly important that we finish this work that's before us, but also make sure that we always are mindful of how important it is to continue to monitor the situation, hold people to account, and make sure we know what is going on. And then I want to thank the many survivors and college students who have been willing to testify about their painful experiences, to inform policymakers firsthand of their experiences with sexual assault and domestic violence and sexual harassment, and then the lack of proper handling of these instances in far too many cases by colleges and universities. And you know, they've been stronger than they should have to be, and I just wanted to express my appreciation and thanks. I'm also pleased that the Senate Education Committee approved Senate Bill 10 by Senator Cleo Fields, which makes kindergarten mandatory in Louisiana for children who turn 5 years old. This too is a part of my legislative package, and of course that can be accomplished through private school, parochial school, public school, and homeschooling, just like 1st through 12th is now. But I think we can all agree that education is the foundation for success, and ensuring that all of our children are given the necessary building blocks as early as possible to set them up for success, and they can live up to their God-given potential. And I think opportunity and prosperity hinge on education, so this is very important. Now, transitioning to COVID, I'll give you the daily report. We were reporting today 615 new cases on 22,705 tests. Unfortunately, we're also reporting 8 new deaths for a total of 10,324 deaths since the start of the pandemic due to COVID-19. 334 individuals are hospitalized across the state of Louisiana. That's down 2 from yesterday. 41 of those individuals were on mechanical ventilators, and that's down 1. As of today, 1.5 million Louisianans have initiated their vaccines, and over 1 million have completed their vaccine series, and we've administered right at 2.5 million doses of vaccine in the aggregate. You're going to get more information about the vaccine and so forth from Dr. Cantor in just a moment. We are starting to see an increase in vaccinations at the new community vaccine site in Baton Rouge, but I will be the very first to tell you that demand at that site is not what we need it to be, not what we hoped it would be, and we're working very hard with the city of Baton Rouge to try to make sure that more Louisianans take advantage of this opportunity. We estimate that about 25% of the residents of East Baton Rouge have been vaccinated. Certainly that's progress, but we need that number to increase, just like we need it to increase all over the state, quite frankly. And this site is an easy and great opportunity for those who live in and around Baton Rouge to get vaccinated. The community vaccination site at the Bon Carré Business Center on Florida Boulevard is convenient. It's open to the public, and I encourage everyone to take full advantage of this opportunity to receive the vaccine, which is Pfizer, in case there are questions about that. We are asking for the media's continued help in reminding people that it's here, that it's open. The hours of operation are designed intentionally to be convenient, whether you work or not, and if you work, what time of the day you work. So the hours of operation are 8 a.m. to 6 p.m. on Tuesdays, Thursdays, and Fridays. On Wednesday and Saturday, the site is open from 10 a.m. to 8 p.m., and on Sundays, it's open from 10 a.m. to 6 p.m. If transportation is an issue, we've got that covered for you too. If you need a ride to the location, anyone can get a free ride to the site using Uber, and the Uber code is 10MVBRLA. With respect to vaccinations, generally speaking, we continue to be in a race against time, just like the rest of the country, just like the rest of the world. Variants of the virus are highly transmissible. They are spreading across the country and the state. Dr. Cantor is going to get more into this in just a moment. And just when we need it most, we are going to start seeing, and you are going to start seeing, our Bring Back Louisiana campaign ramp up and become even more robust going forward. I can tell you that pilots are happening in all 9 public health regions starting this weekend. This is the schedule of events that I've put up, and the information is too much for me to go through, but this slide will be available to you in the press so that we can make sure that individuals are aware of their opportunities over the weekend with respect to these initiatives. We are trying very hard to meet people where they are. And this is especially important once you get to a point where the demand no longer exceeds supply. And that's where we are. We want to make it as easy, as convenient as it can possibly be for people to be vaccinated. And last week, community partners knocked on several thousand doors, handed out thousands of door hangers and flyers, made thousands of phone calls, and sent texts and so forth. This Monday, there will be about 105,000 pieces of direct mail that get sent out to make sure that people are aware of the opportunity to be vaccinated and the fact that they should be vaccinated. You can follow the campaign on social media. The handle is @SleevesUpLA. @SleevesUpLA. We have a COVID vaccine hotline. You all know that. That number is 1-855-453-0774. And I'll give you that number again. It's 1-855-453-0774. There have already been close to 2,000 calls to the hotline. More than 600 appointments for vaccines have been scheduled. This line can be used to schedule an appointment, but also to be connected to a medical professional who can answer any questions you might have about the vaccines. And I'm going to encourage people that when you decide to avail yourself of the vaccines and to be vaccinated, to make sure that you are encouraging other members of your family, your community, your neighbors, people you go to church with, work with, whatever, to be vaccinated as well. Because we don't get through this pandemic until a certain number of people and a certain percentage of folks are vaccinated. The sooner we get there, the better. And as we transition to that point, there will be a greater and greater return to normalcy, and we will greatly reduce the likelihood of another surge like we had coming out of the Christmas break, as you all can remember, when well over 2,000 people were in our hospital at one time, when we had daily death counts that sometimes exceeded 100. We don't want to go back there, and we want to make sure that we are making progress. So I encourage everyone to be vaccinated. I am also mindful that for people who, for whatever reason, are hesitant, my voice is not necessarily the one that's going to convince them. So I encourage them to reach out to their doctor, get their questions answered, and develop confidence that I believe you should have in the vaccine, and get vaccinated. At this time, I'm going to ask Dr. Cantor to come up, and then I'll come back when he's done to wrap up and take your questions. As I always do, please try to address your questions that you have to Dr. Cantor while he's up here, and then I'll come back up in just a minute.
Good afternoon. Thank you, Governor. Thank you for your leadership. Appreciate everyone being here. As the Governor alluded to, not just us, but across the country and across the world, there's a particular urgency with the vaccine efforts right now. With the variants, and you can look across the country, and the Northeast and Michigan, a couple other states are really experiencing that, and we should feel it too. I think we should feel urgency in availing ourselves of the vaccines, particularly because we have decent supply now, and that really is a gift. I'm going to come back to that point in a second after I give a couple updates. The vaccine rollout continues to go well. I can tell you that as of today, we have initiated the vaccine in 31.4% of all Louisianans. It's about 1.45 million people. We've initiated the vaccine in about 41% of people 18 years of age and older, and about 74% of people 65 years of age and older. And we've completed the vaccine series in almost 25%, almost a quarter of the population of Louisiana. Those are really, really encouraging. Those are really encouraging numbers. A lot of hard work went into them, but still we have a long way to go. And, we are, it's clear that we're entering another phase of the vaccine rollout, and it's not just Louisiana. Really, most of the country is in this bucket as well, and it's going to be a more challenging phase. In the beginning, right in the beginning of the vaccine rollout, we were so limited in supply, and we were really triaging vaccine to the people who were most at risk of complications or exposure: elderly people, nursing home residents, healthcare workers, and so forth. We then went into a second phase where eligibility was able to be opened up as more supply came in, and there was a rush of people to get vaccinated who were really eager and excited to do so, and that was encouraging. We're going into another phase now where we need to be targeting Louisianans who have been waiting and seeing what's going to happen. They might have questions. They might intend to get vaccinated, just don't happen to feel that urgency at this moment. They need to have conversations and talk to family and friends and find time to do it. That's the target that we need to be reaching out to right now. And again, it's really a lot of the country. It's been noted that this past week, vaccinations in the U.S. as a whole went down 11% from the week prior. So I think a lot of states are entering this phase now. It's going to be a harder phase. It's going to be a more challenging phase for us. It's going to be more work. It's going to be more deliberate. But this is what we have to do. We need to be reaching individuals to engage in conversation, get questions answered, and help people get connected to vaccine events. That's really where the opportunity is right now. That is what the Bring Back Louisiana campaign really is all about. It's about going to meet people where they are, going into neighborhoods, brokering the conversations, getting people connected with experts, information, appointments, ultimately shots in arms. Very encouraged that there's going to be vaccine events happening in all 9 regions of the state this weekend. There's been thousands of doors knocked on in Baton Rouge already as part of the campaign to promote the site at the Bonacary Center, and that's going to increase throughout the state. That's going to be where the opportunity is going forward, is reaching people directly And on behalf of the Department of Health, we are doing everything that we can think to do towards that end and are asking for suggestions to go beyond that. And really the goal here is to reach people who are going to get vaccinated at some point, and that's a wide swath of the population, and to encourage them to do so now, because as the governor alluded to, there is this urgency with the variant. So we have an opportunity now to prevent what could be another surge in cases if we increase vaccinations, and that's absolutely what we have to do. Some other encouraging news: we have continued to make good progress addressing racial disparities in vaccine administrations. In Louisiana, this has been the result of really concerted efforts and neighborhood-based outreach. I can tell you that as of today, 28% of all the vaccine administered in Louisiana has been administered in Black Louisianans. Black Louisianans account somewhere between 32 and 33% of the population of Louisiana, and that number, that 28%, has been steadily increasing each and every week since we started counting it, which is encouraging and really the result of hard work. If you look at the national numbers, we're actually ahead of the nation right now in terms of addressing this particular disparity, getting people vaccinated by a virtue of what percentage they would be predicted. And that really is as a result of the hard work. We also have some of the best data in the country behind this. And when the CDC puts out numbers on racial demographics of vaccine administrations, they only have data on 55% of every dose administered in the country. In Louisiana, we have data on 91% of doses administered, and that's a direct result of some incredible work done by the Office of Public Health. So we have quality, near complete data that we're looking at, and the progress shows because we've been making improvements in that disparity each and every week, and I think we'll continue to do so. I also want to mention there's been another study relating to pregnant women and vaccine safety that was released just 2 days ago that is impactful and adds to the now really wide body of evidence that supports vaccine safety in pregnant women and women of childbirthing age. This was published in the New England Journal of Medicine, again, 2 days ago. It looked at 35,000 pregnant women who received either the Pfizer or the Moderna vaccine, either during or up to 30 days prior to becoming pregnant, and showed that there was no difference in side effects from the vaccine or pregnancy-related measures such as miscarriages and other pregnancy complications because of the vaccine. Really a significant piece of data adding to the evidence that is amassed showing that these vaccines are not only safe in women who are pregnant, but highly efficacious in protecting them from the complications of COVID. We know that COVID is can be detrimental to a pregnancy. It increases maternal mortality and increases the chance of miscarriage and preterm labor. We know that, and now there's even more evidence showing that that the vaccines are safe in this regard. I can tell you, I'm not just saying this. I've shared before with folks that my wife and I are expecting, and my wife is now fully vaccinated. She got vaccinated during the pregnancy, and we're very proud of that. And during the State of the State speech, the governor spoke about a physician and obstetrician by the name of Dr. Jane Martin, who also not only is an expert in maternal fetal medicine, but herself got vaccinated during her own pregnancy. If you talk to obstetricians and maternal fetal specialists, they will tell you that by and large, getting vaccinated for women of childbearing age or currently pregnant is the advisable thing to do. Protects them, and we now know it also confers protection to the baby, both in utero and via breast milk afterwards. So a lot of protection, and every day now more data showing that it really is a safe and advisable practice. We are seeing some breakthrough cases, and again, these are cases of diagnosed COVID in an individual who's 14 or more days out from completing their vaccine series. Nationwide, there's about 5,800 or so cases. In Louisiana, we've identified 367 cases. And the way to frame this is no vaccine is 100% effective 100% of circumstances. Of course not. And even the Pfizer and the Moderna, which are 94, 95% efficacious, those are incredible numbers, but not 100%. And this is what we see with vaccinations. This is why herd immunity, getting everyone else vaccinated, is so important because it just reduces the transmission and reduces the risk. Of those 367 cases, 65% in Louisiana are women. 50% are individuals who are symptomatic with COVID, the balance being individuals who were asymptomatic with COVID. And of those 367, which I'll say represent 0.03% of everyone fully vaccinated in Louisiana, of those 367, 21 have been hospitalized, which represents 0.002% of everyone in Louisiana who has been fully vaccinated. So I think those numbers are to be expected, but they are important to track. And again, as the governor has said, getting vaccinated yourself is not enough. We really need you to become an ambassador and get those around you, get those in your life vaccinated as well. And tracking these breakthrough cases, I think, illustrates that. I'm going to talk a little bit about what the virus is doing. And we do have some concerns now, and I'll share some data that reflects the beginnings of potential rebound of cases throughout the state. Percent positivity as of yesterday is now 3.5% in the state. That's up from 2.5 or 2.6%. We now have increases in incidence, which is the number of new cases diagnosed on the state as a whole, and also in 7 of 9 regions. And percent positivity has increased in 8 of 9 regions. We now have exactly half of the parishes in Louisiana are in the top 2 risk categories for community transmission, the highest and the high category. Exactly half the parishes are there, and that's up from the week prior. So this is likely due to the variant. I can tell you right now, of all the COVID circulating in Louisiana, 33.3% is the UK or the B117 variant. While that is less than the US average of 44.1%, and also less of some of our larger neighbors. For example, Texas is at 44.7% and Florida is at 54.6%. It still is significant, and it's driving transmission. So people have every reason, number one, to be careful and vigilant, and number two, if they have not done so yet, to get vaccinated. Getting vaccinated is the single best way to protect against this variant and to protect the state against another surge. The single best thing to do is to get vaccinated. We do not yet have any identified cases of the South African or the B1357 variant. In the US, 0.7% of all COVID is attributed to it. All states in our region do have that particular variant except for us in Arkansas. We likewise do not have any identified cases of the P1 or Brazilian variant. In the US, this variant is accounting for 1.5% of all COVID being transmitted, and it also is in every state in our region except for us and Alabama. We track these closely. I will let you know if any of that changes, if we identify those type of variants in Louisiana. Taking a step back, really, it is concerning to see the beginnings of rebound in COVID, but what is reassuring is we have a tool that we did not have the last time we had this conversation, and that is the vaccine. It truly is a gift. We have, thankfully, enough supply for anyone that wants it in Louisiana right now. It's our opportunity and our responsibility to use that. And I'll remind folks that it's not just about protecting yourself, although it certainly does that. And the more that we learn about long-term complications of COVID, long haulers, for example, it's a poorly understood area now, but there's more and more accounts coming of what the long-term effects of COVID can be. I encourage people to recognize that even if they think they themselves are low risk for serious outcomes of COVID, if they're on the younger side, if they're relatively healthy, they're still at risk for these more indolent long-term symptoms that are being described now. That's one half of it. The other half of it is your family, your friends, and your coworkers. And the best thing that you can do to protect them, to make a safer environment for your family, for your coworkers, for your business, is to encourage everyone around you to get vaccinated. Again, it's our opportunity, and I think it's our responsibility, and that's going to continues to be where we're going to put concerted effort going forward, is reaching people, as the governor said, where they're at, and encouraging vaccinations in any and all settings possible. I'd be happy to answer any questions if there are any. Yeah, Belinda?
Can you talk a little bit about the Johnson & Johnson vaccine and whether the temporary pause on that vaccine has somehow contributed to vaccine hesitancy, or just the fact of not having a single dose vaccine has made it harder to get to some communities?
I think the latter is more accurate. The question is what the effect of Johnson & Johnson is, vaccine confidence versus just the logistics of not having the one and done vaccine available. It was a very popular vaccine. In fact, much more popular than I think some people worried it might have been, because the data on the trials was a little bit more nuanced, but it's a highly efficacious, very safe vaccine. And I think that's what's going to be confirmed at the Advisory Committee on Immunization Practices meeting tomorrow. The CDC committee is meeting tomorrow. They're widely expected to render a decision on what they think is the best course forward. We don't believe that there's been a significant increase in reports of what's called this vaccine-induced thrombocytic thrombosis, or these accounts of these serious blood clots in the setting of low platelets, which is a very rare thing. We have had none reported in Louisiana. We got word that there are a handful of additional reports across the country, but not a ton. And I think the committee is likely to render a decision that paints a pathway forward for Johnson & Johnson. In my mind, this process, this 2-week, it would have been 2-week pause essentially, of the Johnson & Johnson was unfortunate because a lot of people wanted that vaccine here, but ultimately reassuring. I mean, if anyone harbors questions about transparency of the FDA and the CDC, how serious these federal agencies take safety, the evidence is right here. It only took 6 cases to cause a pause, to say put pause on this. And furthermore, the fact that the FDA and the CDC were able to recognize 6 cases of this incredibly rare disease and act so quickly is incredible. It would not have been possible 20 years ago. It really gives a lot of confidence in the process. The process is working for the public the way that it should. So I think that's going to be recognized whenever Johnson & Johnson gets put back into circulation. I do think there's going to continue to be a lot of demand for it, and I think it's going to be useful because the logistics of it, having a single dose that does not require arduous cold chain storage, is going to make it easier to get people in various locations. So I'm looking forward to that. I neglected to mention earlier in my comments how much vaccine we're going to get next week. So I do want to mention that our allocations on the state allocations are exactly flat from this current week. So we'll be receiving 69,030 doses of Pfizer, 50,700 doses of Moderna, for a total of 119,730 doses. An additional 60,000 doses will be made available through the federal retail pharmacy program coming in. Those are first doses. They're followed by second doses. Those are all first doses. Yes, sir.
We're almost a month out from when the last restrictions were loosened. Do you think it's fair to say that those loosening of restrictions didn't have a significant impact on infections, or is it still too early to say, or what impact do you think that had?
I think that's fair to say. I think increases now really are likely attributable to the variant. I think that's fair. Yes, sir.
We're seeing now things like shots for shots happening here in Baton Rouge to target that younger demographic to get vaccinated. How much of an emphasis is the Department of Health, along with the governor, putting on to get younger folks vaccinated here now?
Yeah, that's a great point. A lot of emphasis, and more emphasis going forward. Again, part of this Bring Back Louisiana campaign is doing smaller and smaller events, more targeted, more grassroots. And I think that's where the gains are going to be made a lot. I mean, I think, in this new phase where we're really targeting people that or want to get vaccinated, just don't feel that urgency right now. That's exactly where we have an opportunity to do so. The event in New Orleans, I think, was highly successful. I think there'll be more and more creative events. And, I'll just put the call out there. Now that we have a lot of supply, anyone in the state that has an idea or wants to do a vaccine event that they think is novel, that they think is going to get interest or be exciting and be able to reach people that haven't been reached, we would love to hear that, and we would love to partner with that. Yep, Melinda?
Is there any concern about, now that we're moving to the point of having a supply of vaccine that we're hanging on to, is there any concern about storing it and having enough capacity to hang on to it for longer periods of time?
Not particularly. I mean, we keep track on those type of things. Typically, this vaccine, when it remains in cold storage, can last for decent amount of time. And, we're not obligated to draw down vaccine until we think we have a need to do so.
So have we gotten to the point where some other states have stopped drawing down supplies of vaccine? Have we gotten to that point?
We have. We've the past week, we did not draw down every dose that was immediately available to us. It's going to stay available to us. It's just going to remain in storage centrally with the feds, and we'll draw that down when we need to, particularly for that issue, so that we don't run into issues with expiration date. Yep, last question.
You're saying you could have gotten more than those doses, but those are the doses that you're getting?
So the doses that I said are a max, and we're drawing down doses as we need. Yeah. Great. Thank you.
Thank you, Dr. Kenner, and that's a lot of information, and there's more that we could share probably. There's always a lot going on, and we learn every time we have our Tuesday morning call with the White House. You have different calls throughout the week with folks with the CDC and FDA and Operation Warp Speed, Dr. Fauci, and there's an awful lot going on. What I want to try to reassure people is that we're doing everything that we can to make sure that that this vaccine is safe and it's effective, whether it's Moderna or Pfizer. There's a decent chance that in the near future, Johnson & Johnson is going to come back online. If so, I will tell you, I believe that it is safe as well. And somewhere around 15 or fewer incidents have been reported on almost 7 million vaccinations. There are lots of pharmaceuticals that remain authorized and in use every day in our country and around the world that has a much higher rate of significant complication than that. But we hopefully, and we will know, I think, as early as tomorrow when the ACIP meets, about restarting Johnson & Johnson and that being available to individuals as well. And then I want to point out that the same surveillance system employed to detect those 6 cases of Johnson & Johnson, it is also out there on Moderna and Pfizer. And it is not revealing anything that is really troublesome about side effects and complications related to Moderna and Pfizer. And so that should further amplify the confidence that people have in those vaccines. And we haven't talked about this as much lately, but remember there are certain members of society, certain individuals who are more vulnerable to the disease than others by virtue of their age or their health condition, whether it's heart disease, kidney disease, obesity, hypertension, whatever, diabetes. And it's really important that everybody get vaccinated. It is especially important that those individuals be vaccinated. And if you live with those individuals or you're coming in close contact with them, and I guess what I'm saying is, because if you do the numbers, that's all of us. It is really important that we do this, not just for ourselves, but for our neighbors as well. Before I take questions, I want to give a short weather update. I had a unified command group meeting this morning, and unfortunately, there is another threat for severe weather going into the weekend. At least a minimal threat for each region of the state starting Friday and extending into and through Saturday. The issues are similar to recent weather events with a chance of flooding, severe thunderstorms, hail, and wind damage. And as we've seen this year, it's very difficult to determine exactly where the most dangerous weather conditions are going to occur, and so everyone should be ready. We're also just a little over a month before the start of the next hurricane season. So I'm going to start now reminding people to make sure you're prepared, get a game plan, and go to getagameplan.org if you've not already done so. And then monitor local weather, stay apprised of any warnings or directions that come from local officials as well. I'll go ahead and tell you that the next press conference will be Tuesday, because the current proclamation expires on Wednesday. And so we'll be back here on Tuesday to make announcements about what comes next. And I hope that will preempt any questions out there that are going to try to get that out of me today. I have not yet received the briefing on the gating criteria, and I've not yet received recommendations from my public health officials. And so I'm just letting you know, I'm not going there today, but I'll be happy to answer any other question that you have. Yes, sir.
I still might go there, Governor. Is there any possibility that next week that you could see of you lifting the mask mandate, or is that sort of off the table?
Well, nothing's off the table until after I receive a briefing and get recommendations and make a decision. And you'll learn that on Wednesday, what we do. And that's the way we've handled this from the beginning. Yes, sir.
So for tax bills in this year's session, you've kind of set the guardrail of revenue neutrality. Just wanted a lot of bills flying around in session, obviously. Any take you can offer in terms of maybe bills you like, bills you don't like, overall?
Yeah, well, first of all, I've always supported tax reform. You may remember that in the first term, even as we dealt with the huge $2 billion budget deficit and trying to achieve stability that we've been able to achieve, we were entertaining tax reform, and that is lowering the rates, broadening the base, simplifying our system, and making it become more transparent. The legislature created a task force to study our tax system, both what we have and in comparison to other states, make recommendations about tax reform measures that would improve our tax structure and make it easier to administer and so forth. I embraced all but one of those 16 or 17 recommendations. I continue to embrace those. And those measures that do those things, I'm in support of. And so if you see a bill that would, in a revenue neutral fashion, lower individual income tax rates or corporate income tax rates in exchange for getting rid of the deduction of federal income taxes paid so that it operates in a revenue neutral fashion, that's something that I can support. And you do see those bills. It's just important that we pass a package at once so that it all stays in balance and that we can know that we have revenue neutrality. And why is that important? Well, first of all, people should be mindful that we already have one of the 5 lowest combined state and local tax burdens in the country. Secondly, we know that in 2025, 0.45 cents of the sales tax is scheduled to go away. That's $500 million state general fund. And I refuse to open up a structural budget deficit and leave my successor in the same condition that I was in when I took office. Thirdly, the American Rescue Plan was passed. There's over $5 billion coming to Louisiana, 3.2 to the state, $2 billion to the locals. And it says you cannot lower your revenue by reducing taxes and then use that money to try to make that up. So for all of those reasons, tax neutrality, I should say revenue neutrality is incredibly important. And that's the main guardrail that I have. The second is that it really does need to be tax reform. It needs to be an improvement. Not every change is an improvement. But if it lowers rates, broadens the base in exchange for reduced tax expenditures, then you know, it does look like reform, and we can support it. And so my position hasn't changed from what it was 3, 4, even 5 years ago. Yes, ma'am.
But on that same question, is there a favored approach of, in the lowering of the rate and broadening of the base, do you prefer a flat tax or brackets?
I would be much more open to a flat tax as it relates to the corporate structure, but not to the individual structure. I just don't believe that it is the fairest system that we can have. We have multiple brackets now, and I think we should keep those, and all of them should be lowered in exchange for getting rid of the FIT. And by the way, this is ultimately going to be a decision for the people of Louisiana directly, because none of these changes on corporate or individual income tax will happen if they don't vote for a constitutional amendment, because currently the FIT deduction is in the Constitution. So they will decide whether they want to lower their rates or not. But I would prefer that we not have a single bracket, or I should say a single rate for individual income taxes, because I don't think the poorest person in our state should pay the same thing on the first taxable dollar as the richest person pays on the last taxable dollar. Yes?
President Biden recently said that the goal is to have a somewhat normal 4th of July with COVID-19. Do you see the state on that same track, and do you think the hesitancy that's happening right now is going to slow that down pretty significantly?
Well, the hesitancy is certainly an issue here and elsewhere, because the longer it takes to get to that number, that percentage of people to be vaccinated, we know the longer it's going to take to get back to normal the way that we all want to. And quite frankly, we don't end the pandemic. And I think everybody should understand this too. The pandemic is a global pandemic. And so we can make improvements here, but ultimately, and I'm not trying to say this so that everybody loses hope, what happens in Argentina and in Spain and in Israel and in India and everywhere else is important ultimately as to what happens here in the United States and in Louisiana. But we're responsible primarily for ourselves right now. And if we're slow to get the uptake that we need on the vaccination, the longer it takes to get to, back to normal. But can we be there more or less by July the 4th? I hope so, especially since on July the 4th, you're typically talking about celebrations that occur outside. They're always safer than celebrations that you do inside and so forth. I hope we can get there. And of course, that's going to be borne out by the numbers, not just on the uptake in vaccinations, but what's happened in percent positivity, what's happened in new cases and hospitalizations and deaths. You know, Dr. Cantor just mentioned over the last week, we've seen some trends that are not favorable, but overall, the baseline numbers remain low and relatively steady, especially if you compare them to coming out of Christmas and over that next several weeks. But I'm optimistic that we're going to get there. I've sort of promised my mama that we're going to have a big 4th of July, something or other. But I happen to know she's vaccinated too, and that we will make sure that we're doing everything as safe as we can. Yes, sir.
Real quick, our investigators at WAB were wondering if you did have a chance to see that body cam footage from that police officer in Port Allen of him tasing a guy. We were wondering if you had any comment on that, if you saw it.
I have not, and thus I do not. Yes, ma'am.
A couple questions about legislative bills that are moving through the process. Do you support, Representative McGee has a bill to expand the medical marijuana program to use the smokable form of marijuana?
Yeah.
I'm wondering if you support that. And then also Senator Jay Morris's bill to allow people to have concealed carry without a permit.
Yeah, compound question? Okay, withdraw an objection, but okay. I will always reserve the right to see a bill as it reaches my desk, because they typically never get there in the same shape as they're introduced and committees do their work. As you know, I support medical marijuana, and if a bill gets to my desk that expands the availability of medical marijuana and potentially expands the forms of marijuana that can be used for medicinal purposes, my inclination is to support it. I haven't heard anything from anyone yet that would cause me not to follow my inclination, but I'm not going to give you a 100% yes or no answer on that. And then the second question.
doing away with the requirement that you have to have a permit for concealed carry?
So I have a history as a legislator of voting against bills that would do away with the permit that is now necessary in order to have a concealed weapon. I'm not going to change my position on that either. I think it strikes the right balance to make sure that individuals go through that background check, that they have training on safety and on marksmanship, and they know how it is that they're expected and by the way, obligated, if you have the permit, to interact with law enforcement when in fact they have a concealed weapon on their person. All of that, it seems to me, is proper. That's the right balance to strike. And I feel very strongly about that. I also feel very strongly that a considerable majority of the people of Louisiana support the system we currently have and don't want to do away with the permit as a requirement for concealed carry.
Last one?
Yes.
Wanted to see if you had any further thoughts on the use of the American Rescue Plan funds. For example, if you have a specific ask for how much you want to put in the unemployment trust fund, and what is the process for that going forward?
Yeah, well, it is a great question, and I'm going to give you the best answer I can, but I want you to understand, we believe we're going to find out on May the 10th exactly how much we get as a state and each local subdivision of government that's going to receive funding. We believe our total will be in the neighborhood of $3.2 billion. We think the locals collectively will get about $2 billion. We don't yet know how that's going to be apportioned in terms of over time. Are we limited to half of that in the first year, for example? How much in year 2 or year 3? We got to make sure we know by when the money has to be spent. We don't know that for sure yet. And then the purposes for which it can be spent. We know the legislation says COVID-related expenditures, you can use it to make up for revenue that you've lost. You can spend it on broadband, water, and sewer projects. So there are 5 enumerated things. But how do you compute your lost revenue? And in the first year of receiving the money, are you limited to only the revenue you lost between 19 and 20? And do you have to use actuals, or can you use projections? And when can you use the revenue losses that you have in 21? We don't know the answer to those questions yet. What I can tell you is I favor using the first draw on the funds, and whether we do it in 1 or 2 years, I'm open, because it depends on how much we get in the first instance, the first allocation, is to replenish the UI trust fund and to make it solvent. We have a solvency threshold that's at $750 million. And if REC recognizes a fund balance in the UI trust fund that is less than $750 million at a September meeting, a tax increase happens by operation of law. I want to avoid that tax increase. I want to get at least to 750. Don't necessarily have to do all of that this year. We can do, so I would, my initial thought is to do $400 million this year into the trust fund, but also pay off the loan that we've taken in order to currently pay benefits. Because you remember, the current UI trust fund balance is zero. It was $1.1 billion at the start of the pandemic. It's zero today. And we've had to borrow interest-free in order to pay benefits. We need to pay that loan back. That's going to be about $200 million more. So for me, the right number is somewhere around $600 million for the Unemployment Insurance Trust Fund and paying the loan back in year 1, but making sure we have a fund balance of at least $750 million after year 2. And then you get into a lot of other things that I think are really important, and I think there's going to be agreement. We've got to restart tourism in Louisiana, and we have convention and visitor bureaus around the state that have lost revenue, and they don't have the ability to do the advertising and the outreach they need to get our numbers back up. We have tourism-related venues with similar issues. Cultural, recreation, and tourism needs some funding to advertise for Louisiana. There is the first installment on the hurricane risk reduction system. The non-federal match is due in September. That's $400 million. We could use, potentially, depending on the rules, we could use this money to pay that first installment and make sure that that's a debt we don't have to bond out. or we could choose to put more money towards traditional infrastructure projects. So there's some decisions that have to be made. I want you to know that I have been in discussions for weeks now with the with the Speaker of the House and the President of the Senate, so that we can start to look at all these things, because ultimately we won't know until May the 10th what we can do, and we believe it's May the 10th, but that doesn't give us a lot of time to get it done. And so we're going to start working on a plan now, and I've just sort of laid out what my priorities are. Hopefully the legislature's priorities are very similar, but what I can tell you is we know that this funding is one-time money. So we can't use it to create programs that require ongoing expenditures over a period of time. So water, sewer, broadband, all one-time expenditures. Paying down debt is one-time expenditures, and other infrastructure projects, and the UI Trust Fund, all one-time. And I think that's the right thing to do, and that's the best thing we can do for our state. I will tell you that the emphasis that Congress and the President put on water and sewer projects is very valid, especially here in Louisiana. And so we know we have hundreds of millions of dollars worth of needs out there in communities large and small. And through a combination of our traditional capital outlay program and dollars that are made available through the American Rescue Plan, we need to take advantage of this once-in-a-lifetime opportunity to really make gains on having better water systems and sewer systems, which are incredibly important and extremely expensive to repair and to modernize. And so we need to take advantage of that opportunity. Thank you all for continuing to cover the pandemic and all the news related to our state. A reminder, we will have our next press conference on Tuesday, and we anticipate that we will be announcing the decisions we've made with respect to the proclamation that ends on Wednesday, and the new one that we'll have going forward. So thank you all. I continue to appreciate the people of Louisiana, and I want to finish the press conference by once again appealing to everyone to make sure that you're vaccinated as soon as possible, that you encourage other people to be vaccinated as soon as possible, and that we are careful in the meantime to abide by all the mitigation measures in place so that we're not spreading the virus unnecessarily as we ramp up the number of people who are vaccinated. And as always, I want to ask the people of Louisiana to pray for our state, pray for leaders, pray for our people, and then let's lift up in prayers the victims and the families of the Sea Corps vessel that was overturned last week, and that has also been just a terribly traumatic and tragic incident for all of those individuals and their families. Thank you all, and God bless.
Get ready to go where no dinosaur has ever gone before. PBS Kids